Good morning and welcome to week 4. This week we're going to be going over clinical records. Think of it as easy as the patient chart. So everything that's going to be in a patient chart, whether it be in a paper file folder or on the computer. So it's going to have different components. The registration form, which is the forms that the patient fill out, whether it be digital or on a paper form. Their health history. So that's going to be the information that they put as far as surgeries, any medications, any medical conditions, or anything that we need to know about their medical information that's going to affect their dental treatment or anything like that. Their clinical chart. So that's going to be the part that you're going to see that's going to have the teeth number, any of the treatment that they have existing, treatment to do, things like that is going to be the clinical chart. Any lab findings, so any information, lab slips that we're going to send off to the lab. That could be impressions, models, digital files, things like that. Any consent form, so whether that be in the patient initial form that they sign to give consent for treatment, or any consent forms that we have them fill out for treatment that they are agreeing to. And really anything that has to do with the care of the patient that's kept, again, in a file folder, a paper folder, or on the computer, as well as their x-rays. So that's going to be part of the clinical record as well. So anything that you can find under the patient's name, more so in the computer on a program like Eaglesoft or Dentrix, which you will see soon, that's all going to be part of the patient's clinical record. So key components of the clinical record is you want to make sure that it's organized, that it's consistent, and that it's complete. So you don't want to leave anything blank. You want to make sure that everything is charted and that everything's clear to read to make it easy in case you're ever needing to use it for any other purpose. So it's going to be used in the operatory. So when the patient is sat, if a dentist is still using paper charts, their chart is to be in the room with them or open up for the doctor to see when they go in there. So that'd be the clinical chart and the x-rays, usually digitally, or what we have open, and we have the ability to open any screen that they may need when we're in there. You want to make sure that is being updated. So for example, every patient that gets seen, they should be asked if there has been any changes in their health, medical conditions, are they still on the same medications? Have they added any medications, any changes? We want to make sure that we update that. Same thing with consent forms, that those are put where they need to be and any updates that are made. Treatment plan, anything new that we want to make sure that we add that in, and that's available for people to see. So in the means of using it for forensics, I have been asked to submit x-rays for a deceased patient because every mouth is unique. Even with twins, no two mouths are the same. So where our fillings are, the way that our teeth are, the way that our roots can be, sinuses, all of that can help identify a patient. So I have been asked to subpoena the records for a patient to be identified. So it is done. Unfortunately, so it is done to make sure that you have the correct patient. It is part of, it could be part of lawsuits or, like accidents. If patients are in a motorcycle accident and they need before and afters, that is also something that can be used as evidence. But of course, we have to have consent forms for everything like that to release that type of information. Third-party payments, that just means dental insurance companies that they might ask for something that they want to see. So we take very clear records when we're doing treatment to make sure that we send it in. So for example, if we're doing a root canal, they might want to see the infection of why we did the root canal. If we did a crown, they want evidence that there was enough tooth structure gone. And they are getting really, really picky because these days people are sending things to the insurance company falsely. So they're asking for more and more information. So you have to keep that as part of the clinical record. So it is important to know that this is a legal document. So it has to be clear, organized, and complete. Another part that you don't usually think about is the financial records. You'll see it later on in lab when we go through the financial ledger, payments, things like that. That's a legal part of the patient's record. And of course, HIPAA, everything we must keep confidential. So, for example, if a husband has a balance and the wife wants to know about it, he has to give permission for that. You can't share any information with any family, friend, regardless of their relationship. It all has to be confidential. So you want to make sure that we don't leave screens open, that we don't leave charts laying around. For example, one thing that's great to practice is once a patient leaves the operatory, you close their charts and their x-rays. That way, when a new patient walks in, they don't see the information of someone else. One thing that will be come up on quizzes and potentially your final is that the dentist owns the records. So the patient, that they own the information in the records, but it's the ownership of the dentist or the owner of the practice. So a patient can request their copies of their records, but they can't have the original records. Again, a lot of times now everything's digital, so there's no way for them to have the original record, but we can send copies of x-rays, of different information to other offices, especially if they move out of state or move away and they want to transfer the records. That is absolutely okay to send copies. Of course, we have to get written permission from the patient to be able to do that, but the doctor owns the original record. So file folders are the patient chart. That's a file folder, and it'll have a sticker on it with the patient's name, and it might be color coded in a certain way. And then of course it would have like the film x-rays that they used to have in a file folder, but then now everything's digitized. So we do keep those file folders still because it has their dental history, it has old x-rays, it has old information, but everything has been digitized for quite a few years now. As we talked about the medical history, that's going to be all the information from the past and the present. We do need to know things that happened previously. And so we want to make sure that in our forms that we have them fill out, we're very detailed on what we have them let us know. Because sometimes if they have had prior surgeries a long time ago, it can be important. Or if, they were on a certain type of medication before and now they're not, we do want to make sure that that's always continued to be updated. So, another thing here on slide 7 is going to be the exam form. So that's going to be the doctor going through checking on what do they have currently in their mouth from someone else. What teeth might they be missing, any oral hygiene information like their perio charting. We want to make sure to have all that. And then in order to do a treatment plan form, which is what did they have before, now what do they need to have done now? And you want to keep a copy of that always, because then sometimes they have questions when time goes on what goes on there. And then the progress notes on slide 8 is going to be the chart notes. So what happened that day? They came in, they had a concern. What did the doctor do that day? Did they do a filling? Did they suggest sending to another office? That's going to be the progress note. It's going to be the chart note that the dentist write about what happens that day. That way, if someone else works on them or they see the hygienist next, they want to see what happened last time. All they have to do is open up the progress note and read, and they should be able to tell from that note exactly what happened on that visit. So if we're writing in paper charts, it should always be used in black ink. It should be legible and it should be accurate. So that's something you want to remember. Always use black ink. And then never are we to white out any record. And remember, that is because this is a legal document. So we should not be whiting out. Nothing should be appears to be like hiding something. So when we make corrections, we just cross it out. That way you can read what was there before and then write the correction on top of that. So that's something that you may be tested on as well, is that never use whiteout. If you're going to make a correction, you do a line through it and then write the proper changes on top of it. So if that were to happen, you want to make sure to write any initials to change, and then whoever's writing the chart note should have their license number and their signature with that chart note done by the doctor or hygienist, and of course the date as well. So going down to slide 9, we talked about consent forms already. Any financial documents or things sent out to the insurance via paper should have a signature form to make sure that we have permission to do what we're allowed to do financially. If there is a payment plan arranged, we have to have all those signatures, again, being clear and complete. We want to make sure you have that information, or else we're not allowed to submit those things. And then when the patient is filling out the records, sometimes they may need help filling out the forms if they just maybe don't understand some questions. So you want to make sure that it is in a private room. That way they feel comfortable answering those questions. So I have most of my patients filling out forms digitally ahead of time. However, if they don't want to do it digitally, some don't like the security of having things online, I make sure to have them arrive 15 minutes earlier to have time to think clearly and go through all the questions and make sure that it's complete and concise and clear. So the law does say that we must store records from 6 to 7 years and make sure that they are not to be destroyed. So if it's a file folder and it's a paper copy, it has to be fire safe and flood proof. So if records are kept now digitally, we have to make sure that those are backed up and that we are able to access those records whenever we need. And if we have a patient that we don't see anymore, maybe they moved away or maybe they just stopped coming, we have to keep their records for at least 6 to 7 years. So that's law. The original record, so if it's a file folder, it needs to stay in the office at all times. It is never to be taken physically anywhere else, mostly because of HIPAA reasons, and 2, because you don't want it to get lost. So at the end of the day, if you have file folders, they should be locked, kept safe in an area that is, again, fireproof and floodproof, and make sure that the computer records are being kept password protected, everybody signed off, just kind of like we do in the lab, everything to be shut down, signed off, password protected. That way nobody is able to log on and get private information for HIPAA purposes. So things should be backed up monthly, daily, and the server, the main server, if the building were to completely burnt down, you want that information stored somewhere off-site. So the way that everything works on the cloud now, right, as long as it's really secure, you're using a secure company, if the whole office were to burn down, you don't lose any records. You should have records from just a day old and longer. So that is very important to make sure, with everything being digital now, that you use an offsite place that is secure. And there's usually companies that work strictly with dental offices or medical offices to make sure that is secure and safe and that there's no breach of security. So if you have any questions, please let me know. I think this is pretty straightforward working in the patient chart, because hopefully you've worked with it before, but we're going to be getting a chance to do that in lab for the next, throughout the semester. So I hope you all have a great rest of your week.